10 years ago, disease like diabetes, fatty liver, hypertension, and heart disease were considered problems of older age. But today, people in their 20s and 30s are being diagnosed with fatty liver, obesity, PMOS, prediabetes, and even heart attacks. Hello everyone, I am Dr. Archie and welcome to my channel Heal Before Pills. Before we begin, let me tell you what Heal Before Pills means. It means giving your body the care, attention, and healthy habits it deserves before disease develops or progresses. It means understanding that many lifestyle disorders don't appear overnight. They are often the result of small habits repeated day after day for years. And the good news is that small positive habits repeatedly consistently can also help prevent many of these diseases. That's why I strongly believe that prevention is the best medication. During my time in the hospital and OPD, I have met countless patients struggling with conditions like fatty liver, diabetes, obesity, hypertension, and PMOS. And very often they tell me the same thing: Doctor, I wish I had known this earlier. That's exactly why I started this channel. My aim is to spread awareness, simplify medical information, clear common myths, and help you recognize warning signs before they turn into serious health problems. Because health is not built when we get sick. Health is built every single day through our food choices, physical activity, sleep, stress management, and daily habits. So, in today's video, let's understand what lifestyle disorders actually are, why they are becoming so common myths and misconceptions, early warning signs, tests you should know about, and most importantly, how to prevent them. Let's get started.
What are lifestyle disorders?
Lifestyle disorder disease that are strongly influenced by the way we live. They are linked to unhealthy eating, habits, lack of physical activity, poor sleep, chronic stress, tobacco use, excessive alcohol consumption, and obesity. Some common examples include obesity, fatty liver disease, type 2 diabetes, high blood pressure, high cholesterol, PMOS, heart diseases, and stroke. The World Health Organization classifies many of these under non communicable disease, which are among the leading causes of death worldwide. The important thing to remember is that disease usually develops silently over years. You don't wake up one morning and suddenly get diabetes or fatty liver. Your body keeps giving small warning signs long before the diagnosis appears.
Why are lifestyle disorders so common today?
This is probably the question I hear the most. Doctor, why is everyone suddenly getting these diseases? The answer lies in the way modern life has changed. Today, many of us sit for long hours, exercise less, sleep less, experience more stress, eat more processed food, spend more time on screen than ever before. Our lives have become more convenient. Unfortunately, our bodies were designed to move. According to global health data, physical inactivity alone contributes significantly to the burden of chronic disease. Many people believe I don't eat too much, so I am healthy. But health is not determined only by how much you eat. It also determined by what you eat, how active you are, how you sleep, and how you manage stress.
Doctors myth busting session. Lifestyle disorders happen only to older people.
Absolutely not. Today we are seeing obesity, insulin resistance, fatty liver, PMOS, and prediabetes in teenagers and young adults. Age is no longer a guarantee of protection.
I'm slim, so I can't have a lifestyle disorder.
This is one of the biggest misconceptions. Many people have what we call normal weight obesity or hidden metabolic dysfunctions. You may appear slim from the outside but still have fatty liver, high cholesterol, insulin resistance, and prediabetes. Your blood tests don't care what your Instagram picture looks like.
What are the early warning signs?
This is the most important section of today's video because lifestyle disorders often remain silent for years. Some warning signs include increasing waist circumference, weight gain, persistent fatigue, low energy, frequently acidity or bloating, poor sleep, snoring, darkening around the neck or underarms, high blood pressure, irregular periods, difficulty losing weight, elevated blood sugar, elevated cholesterol, fatty liver on ultrasound. As a doctor, one of the most common condition I encounter is fatty liver. Many patients come for routine checkups or unrelated complaints and are surprised to learn that they have fatty liver despite having no obvious symptoms. But it's not just fatty liver. I have also seen patients diagnosed with diabetes, hypertension, obesity, and high cholesterol only after complications or abnormal investigation brought them to the hospital. I still remember a female patient who had been experiencing headaches for a long time. She thought it was a stress, lack of sleep, or simply a busy lifestyle. When her blood pressure was finally checked, it was dangerously high and required immediate medical attention. What struck me most was that she had no idea that something so serious could be developing silently. And that's exactly what happens with many lifestyle disorders. They don't always announce themselves loudly. Sometimes they progress quietly for years before they are detected.
How can you check if you are at risk?
Many people ask, Doctor, what test should I get done? A basic health screening may include weight and BMI, waist circumference, blood pressure, fasting blood sugar, HbA1c, lipid profile, liver function test, thyroid profile when indicated. And depending on your risk factors, your doctor may advise ultrasound abdomen, additional metabolic testing. Please don't wait for symptoms. Prevention and early detection always work better than treatment.
What happens if we ignore these warning signs?
Let's take fatty liver as an example. Many people think it's just a fatty liver, but over time it may progress to liver inflammation, liver fibrosis, cirrhosis, liver failure in some cases. Similarly, prediabetes can become diabetes, mild hypertension can become heart disease, and being overweight can gradually affect almost every organ system in the body. The earlier we intervene, the better the outcome.
Most important question, can lifestyle disorders be prevented?
In many cases, yes. And that's the encouraging part. You don't need a miracle supplement. You don't need a detox tea. You don't need extreme diets. You need consistency. Start with the basics. Walk daily, do strength training at least 2 to 3 times a week, eat enough protein, increase fruits and vegetables, sleep 7 to 8 hours, manage stress, reduce sugary drinks, avoid smoking, limit alcohol, get regular health checkups. Remember, small habits may seem insignificant today, but repeated over months and years, they become either your biggest protection or your biggest risk. If there's one thing I want you to take away from today's video is this. Lifestyle disorders don't start when the diagnosis is made. They start much earlier through the choices we make every day. And same daily habits that contribute to diseases can also help prevent it. That's the entire philosophy behind Heal Before Pills. Not waiting until disease appears, but taking care of your health before your body is forced to ask for help. If you found this video helpful, do let me know in the comments and tell me which topic you would like me to cover next. Fatty liver, PMOS, insulin resistance, obesity, diabetes, or gut health. Don't forget to like, share, and subscribe to Heal Before Pills. Until next time, take care of your health today because prevention is always easier than treatment. Thank you for watching.